right now, which is the healthcare debate in the United States. I want to say something about this, because it too concentrates so much of the essence of this system. Here you have a situation, and think about it, where you have to be working, and close to 10% of the workforce are unemployed, where you have to be working or you have to have a health insurance policy to get health care. This is antediluvian. This is like the age of dinosaurs. Think about that. Health care should be a basic responsibility of society. But no, there are these qualifications, these strictures, and all of them are bound up with private ownership, control over the means of production, the organization of this economy, and what calls the shots? Profit. You have a situation right now where, according to one Harvard medical study, this was in the New York Times, some 45,000 needless deaths take place each year in the U.S. because people do not have health insurance. And there are now some 45 million people without health insurance. And under the most likely of outcomes of this healthcare debate, of this Obama health plan, these people will likely be herded into pools of profitable private insurance investors. You have this absurd and obscene spectacle of a so-called debate around healthcare pivoting around whether undocumented workers will get healthcare. Again, the expendability of a section of humanity. Whether abortions required by women will be financed, when any sense of care and compassion and justice would dictate that these things would be guaranteed in any rational, sane society. But they are not in a society shot through with male supremacy and chauvinism and run according to that profit rules all logic. Now listen to this in terms of the wonderful democratic political structures of this society. There are now, a record has been set, there are now 8 professional lobbyists from the pharmaceutical and healthcare industries. Aha, healthcare industry. That's the nomenclature. It's a sector for investment. It's not healthcare. It's not social needs. It's not social health. There's a healthcare industry. Well, there are now 8 professional lobbyists from the healthcare industry for every single legislator in Congress. This is a new record. And then you have this right-wing madness. Oh, I'm just fine. I'm feeling very healthy. I don't give a shit about anyone else, and anyway, they're just a bunch of freeloaders. That is an important voice at the town meetings in this democracy of ours. You know, there was something very revealing that I heard on a special CNN forum about healthcare. And I was listening to this guy, Sanjay Gupta. Some of you may know who he is. He's the CNN health expert. And he was asked at one point, wouldn't it make sense to focus on preventive care? You know, on the actual health of people as the first priority. You know, this was a question that was put before me, and they were sitting in this forum. They had all their talking heads, and someone raised that. And his answer was, and again I'm quoting, because I had to get my notebook out and take this down after I heard it. He said, from a medical and ethical standpoint, yes, it would make sense to put more emphasis on preventive health care. But from the bottom line, it doesn't. And then later someone raised that it seems as if we should be training more primary care doctors. And Gupta gave the same response. Well, medically and ethically, it makes sense, but not on the bottom line. And you know, Gupta is onto something. I mean, he's not, to my knowledge, a Marxist. At least I haven't found his writings on any of the Marxist websites I go to. But, you know, there is, in fact, a fundamental clash between social need and social health and the imperatives of profit. And this, I think, really concentrates so much of what is before us, this clash between basic needs and the bottom line. The bottom line. And this is what socialism changes. Profit is no longer in command. There is no such bottom line. Under socialism, you'll have an economy that is geared to serving the people and that channels resources and expertise to where they are needed. And serving the people and serving the needs of world humanity, this will, going back to Gupta, Sanjay, this will be the ethics of the socialist society. Now, I want to talk a little more about how we would organize health under socialism, and I would really encourage people to listen to the DVD by Bob Avakian where he talks about this in a section entitled Imagine. Imagine how we can do things differently and what a society that's based on the principles I've been talking about. This DVD is now available online, Revolution, what it is about and how it can be made. Under socialism, how it is possible. Under socialism, you have a new political system that empowers people to solve problems in multidimensional ways, drawing on and mobilizing the skills and knowledge and determination of all to remake society. You will have a society which is consciously seeking to break down the divisions between experts and non-experts, in which doctors will be learning from and actually listening to patients. You'll have medical training that puts doctors in touch with the great needs of society and the world. You'll be spreading medical knowledge among basic people and creating new combinations of the highly trained and the less trained. You'll be treating health issues in an integrated way, in relation to how and where people work and where they live. You'll be dealing with health issues of the environment and carrying out appropriate social investigation. You'll be paying attention to the special needs of women and minority nationalities. You'll combine advanced research with basic ground-level research that directly draws people into these processes of discovery and experiment. And the management and decision-making within medical institutions, whether hospitals and clinics or medical schools, will no longer be the province of a privileged and controlling few. It will involve combinations of administrators, doctors, and nurses, and other medical personnel and medical students, and representatives of the masses. At all levels of society, the basic people will be participating and taking responsibility. And one thing that socialist society will ban forever is the bottom line of patents and property rights over medications and treatments, like AIDS vaccines or new ways of treating malaria. This knowledge, these breakthroughs, these medications will be made available to the people of the world. Or to put it differently, there will be no such thing as big pharma of pharmaceutical companies profiting off disease and treatment under socialism.